as I referenced earlier, there's now many classes of diabetes drugs, and some of them have been in the news lately. I guess the SGL2 inhibitors and their effect on heart failure and cardiovascular disease have been sort of bouncing around in the headlines for the last month or so. So has there been any documented evidence of any particular class of diabetes drugs having a particular effect on eye disease?
Yeah, it's a good question. There's some early data to suggest that might be true, but we really don't know for sure. What we do know, though, is that in essence, any medication that's going to help to lower, A1C and get better glucose control lowers the risk of retinopathy. Whether certain medicines are somewhat more protective or not is still debatable.
And do you think from what you've seen, is that distinction going to be a rather subtle one, and really the clinician and the patient should be focusing, not worrying too much about a class of drugs, but just controlling their A1C level, regardless of the means by which they do it?
Yeah, I think that's probably going to end up being the case, that it's really going to be more about getting the A1C down. I think the choice of those other drugs are probably going to be more driven by what you mentioned earlier, whether they have cardiovascular disease or kidney disease, where there are some clear advantages amongst the different medications.
Yeah, I was just wondering, given that we're talking about a problem of the microvasculature, whether the pronounced effect that SGL2 inhibitors is having on heart failure might translate in some way to...
It might, particularly the fact that it has kidney benefit and in some ways the pathophysiology of renal disease is somewhat analogous to eye disease. And typically, the old dictum is if someone has advanced kidney disease from diabetes, they almost certainly have to have some eye retinopathy. And if not, then their kidney disease probably wasn't diabetes related; it was something else. So they're both diseases of leaky blood vessels.
Interesting. Well, that would seem to suggest that SGL2 inhibitors may, maybe at least it's worth
leakiness. So it's a little harder to relate, but certainly it's interesting.
Yeah, something to investigate rather than necessarily say is so right at the moment.
Yeah, something to follow up on. Yeah, and keep an eye out for, so to speak.
Keep an eye on. It's just impossible to avoid that pun in these discussions. So where are we at in terms of the guidelines and eye checks? So if I have a diagnosis of diabetes, what do the guidelines say now in terms of how often my eyes should be checked?
A yearly dilated eye exam to be able to look at the retina. I will also mention that people with diabetes are also at increased risk for cataracts and other eye disease. So it's not just the retinopathy, but the retinopathy is unique to diabetes. So a yearly eye exam. That said, the rate of the percentage of people that get a yearly eye exam, less than half.